All right, welcome to Fit After 40. Our guest today is Jonathan Brown. He is a Nashvilleian and a native Tennessean and a board certified clinical specialist in orthopedic physical therapy. You did your undergrad at UT in kinesiology and did your doctor of physical therapy at Tennessee State. Is that right?
That's right. Thanks for having me on, Chris. I really appreciate
Welcome,
it.
welcome. So let's jump right in. Tell me about your practice. How do you fix broken down dudes like us?
Oh man, that's a big question. It depends on where someone comes in and where we start. So my practice, I primarily work in orthopedics and musculoskeletal conditions. So I'm working with the aging population, the still thriving population, the weekend warriors, the athlete, preoperative, postoperative surgical conditions, you name it. And specifically, I have interest in working with shoulders, plantar fasciopathy, TMJ pathologies, and really a lot of the clients I'm seeing now are a part of fitness classes, right?
Okay.
So those who want to stay active and they come to me to ask, how can I keep active?
Excellent question, and we're going to get to that one.
Yeah.
I guess let's start with some basic lifestyle stuff. A lot of us spend a lot of hours sitting at a computer, and the back and the neck does not like that. What general advice do you have for guys like us that spend too much time in a sitting position? What should we do to kind of help alleviate that those aches and pains?
Well, it's a common expression. I have a lot of different expressions, and in physical therapy, our profession, we want to use language that, can be caught and be used and make sense of. So something that I often say to folks that I treat and work with is for those, what we call these rounded shoulder positions or that rounded back position, it's not necessarily a pathological condition or position. But what I do say is it's okay to be here. It's okay to be here. Just don't stay here. Let's move. Let's move our body. Let's adjust ourselves throughout the day. We all are going to be confined to a task of work at some degree, but move. And maybe that's once an hour. I tell some patients to set a timer and stand up, reposition yourself, walk around, go get some water, do a few thoracic rotations, a couple reaches over your head, some simple basic things. Now, if it was something that is becoming more pathological with a serious symptom, then I would look a little further. But in terms of general advice, don't stay in one position for too long a time. So it's okay to be here, just don't stay here.
Great. And you know what? Maybe after we get done with this, you can recommend some stretches that may be good for people like us that we could throw up on the blog.
Oh yeah.
But that'd be a lot of fun. Now, when it comes to training, obviously, as you get older, you're a lot more likely to injure yourself. Uh, Can you start by just saying why do we get hurt more when we get older?
Yes. Okay. Love that question. This is something that if I could take a population that's older than the 40, 50, maybe we're going into the 60, 70th, the seventh, eighth decades of life. And I ask some of these folks and I say, when's the last time that you've walked backwards or you've practiced that walking backwards? And sometimes they say, well, they think about it because it doesn't happen too often or maybe not at all anymore. And is it a matter that you can't walk backwards? Is it a matter that because of the age, you can't do certain things anymore that require a little more coordination and balance? And my answer to that, and what's seemed to be proven with the opposite, with the inverse of training, is that it's not necessarily the age that prevents us from doing certain physical activities, but more often I see it's about the time. We don't really have the time to put in as we age and we are busier with our profession, with our lives, with our families, to put in adequate training to what our body needs to do things such as walk backwards confidently and safely. So that's where we come into training. and we do some specific types of training, some specific types of rehab, and I have this person walking backwards, and then we're testing that person on their risk assessment of falls, and it's improved because we've made a little adjustments here. So all right, to answer that question in that geriatric phase, right? Then let's get into our 30s and our 40s. Okay, so why do we have difficulty maybe recovering? Why do we seem to have more increased risk of injury? Or I don't like to use this word, injury prone, because I was termed that in college where I played rugby. And I like to respond with, I just like to go hard. I was always getting dinged in some sort of way, but I would rehab well. But in our 30s and our 40s, we basically reach this level of optimization, kind of our peak, right? And our body's abilities to recover quicker reduces. And that's based on a multi-level of physiological responses of how well we can withstand stress, how often we're taking loads to our tissue that we're not training. And more specifically, at a certain point, we're unable to further develop our amount of type 2 muscle fiber. And that is your fast twitch, power, strength muscle fiber. Your type 1 is going to be more your slow twitch, your endurance-based muscle fibers. For endurance running, we use that a lot, right? There's kind of a mix in the quads. But in terms of doing more powerful movements, having enlarged hypertrophy in these muscle fibers, that peaks. And our abilities to have strength and power movements reduces as well. So that is a classic reason as well. Typically, I see folks who show up who, they've got shoulder pain. Shoulder pain and back pain are really common that we see just day-to-day activity or lifting exercises. And these things can come about because we're trying to do a load that's too much for the joint or the musculoskeletal tissue involved, that we're just not used to firing any more of those type 2 muscle fibers. So it requires training, but there is a physiological reason that we do lose that fast twitch muscle fiber amount as we grow older.
And it does start to decline after 40.
Yes,
now,
it starts to decline after 40. Yeah.
I have heard that there is a really powerful correlation between this muscle mass and your risk of injury, your ability to recover after a fall. Can you talk a little bit about that? Like, should we, what can we do to maintain this muscle mass? What can we do to help prevent these injuries?
Right. And so there's some good studies out there that researchers have done to correlate muscle mass or size with injury risk or prevention. And there is some positive correlation there, meaning that if we can be stronger or have more durability to our day-to-day stresses of life, then we are at a lower risk of injuring ourselves musculoskeletally. But I'll take that a step further, because something that I'm passionate about is not just physical therapy and rehabilitation, it's delivering physical medicine, and how we look at that as we're in these decades of our life now, and we're looking towards the future decades of our life. So going back to your question, I think I just rolled off my head here. So going back to your question, repeat that question one more time. It was
right. So how does this muscle mass help us?
Right. Yes, perfect.
Reduce the risk of injury,
yeah.
Recover faster.
We can do a podcast episode on memory and brain health next time.
Yeah, right.
Of it. There is correlation with that too, with heavy loading exercise with memory. So a lot of correlation there, a lot of promises. So what I was going to say was, not only with physical medicine delivering that, with an increased body mass, if we're talking about not just adipose tissue or fat percentage, we're talking about musculoskeletal mass. It's been also shown to improve our abilities to fight off sickness and disease. So not just a musculoskeletal soft tissue injury, but also pathologies, ailments, viruses, illnesses, colds. So what another better reason to continue to strength train, right? How does that help us? How does that help us? Well, we think about the cell. If you guys were back in high school taking your biology class, or if you guys took biology in college or furthermore, but you think of that cell and it had all these little parts that you had to memorize, retinaculum or reticulum something, or the macrophages. I can't remember all of them inside the cell, but we do remember where the protein came from and where the powerhouse was, the mitochondria. So we go back all the way to this cellular level of the mitochondria, where this powerhouse is, where it's producing protein. Protein is the foundation and building block of our musculoskeletal system. Without it, we're not going to be able to withstand everything that we want to do. So something that we can be looking at is the amount of protein that one is ingesting into their body throughout each day. And it is recommended, in depending on the individual and how much exercise and calories they are going through every day, but 1 gram per pound of protein. You guys have probably heard that, right? For those like you guys who are putting on tons and tons of miles and churning through a lot, maybe need a little bit more than that. So I would say, honestly, if you're having a higher protein diet that's fueling your protein synthesis, that's fueling your muscle fibers and your muscle cells, you're actually going to keep that muscle mass on for longer. So in bouts that I'm not necessarily working out consistently, or I'm traveling, or I'm feeling like I'm getting sick like this week, I'm actually making sure that I get more protein in my system than usual to first fight off any sicknesses, so I can use that as fuel. And secondly, to conserve and withstand the muscle strength or the abilities that I've already built up. So that's actually fueling yourself. It's actually keeping what we have instead of going through a quicker atrophy.
So while we're talking about strength training, and I know that everybody's different. It's hard to make generalized statements about what your goals should be, but obviously your goals have to change as you get older.
Sure.
And my goal with strength training has always been based on my body weight. You know what I mean? I want to bench press my body weight. I want to be able to do 10 pull-ups in a row. So I'm 43. Should that remain my goal at 53, 63, beyond?
I think goal setting is very important. Whether it's you're a rigid goal setter or you're more of a fluid like me. I seem to have trouble just really pinning down these specific numbers, but I will have an idea in my head of, I want to run 13.1 on trail on the Percy Warner Parks here by the end of February. And I've been wanting to do that for a while and kind of got it mapped out, but not specific. I'd be a better trainer if I could do that. But having some sort of goal, right, working towards. I think if we can continue to have goals of what we want to do physically, it's going to continue to promote our health for the long term. So in terms of your specific example of like hitting certain numbers of, if I can maybe deadlift this amount or squat this amount or bench this amount, I've never really taken that approach in my mind. I never had a set number, but I do like to make sure that I can do these primary exercises, or these, almost primal movements, with a moderate to intense amount of resistance, high amount of resistance, to where I know that I can do it. So setting goals for these things, yes. When is it problematic maybe, or when do you stop? You don't. I think as long as you keep training yourself appropriately, then we should be able to do these things for longevity. I have clientele who I see in their 7th, 8th decades of life, and we're working on a deadlift. And the reason why we're working on a deadlift is because we do deadlifts every day. We pick things up off the ground. And I can call it something else. I call it a squat lift. We're going to squat down and lift something. And we start like that. So it is a foundational movement of our bodies and our anatomy. So why should we take that away, right? There's just ways to approach it. If you take an untrained person and you start doing something like that, they're more likely to be in risk of having a flare-up or an injury. But if you take someone like ourselves, as we age and we want to continue growing in that, who is trained, or maybe they're just a runner, there's a less likelihood of an injury there too. So my philosophy, what has also been studied and is really promoted within our profession and the clinicians, researchers, and scientists out there, is continue to strength train and have a combination of not only strength training but also cardiovascular training as well. Yeah, I got a question on that too. I thought of for you
Yeah.
guys. I've heard this a couple different scenarios as I listened to a couple of different researchers and clinicians and spokespeople on the interwebs. And one scenario I've heard is if you could only do 5 exercise movements for the rest of your life,
Mm-hmm.
what would they be? What would they be? What could you name those right now? And so I think for myself, like, what would my 5 be? And I think of like cycling and running, but those are more activities. So I would kind of put those over to the side. If we want to do 1 or 5 exercise movements, so I would do a pull up,
Yep.
I would do a deadlift, I would do a push up, I would do a single leg squat, and I never do abdominal work and sit-ups. I hate them. I've always been like that skinny kid, who's had abs, but they're fake abs, I'm not really strong there. And I think I would do, man, that's a tough one. Did I said single leg squat?
Yep.
A landmine press. I would do a landmine press. Yeah.
So just strength training for me, I would certainly do the pull up and the incline press.
Yeah.
I do split squats as well. And that, so 2 more.
For the rest of your life.
A wood chop.
Ooh, like
Wood
that.
chop.
Yeah.
And oh man, one more. One more.
That wood chop's good. You're getting what we call a PNF pattern, a proprioceptive neuromuscular facilitation. You're going in 3 planes of movement. It's super functional. That's good.
I love that one. And
I
then
want to steal that one. I want to steal that one from you.
The last thing I'm thinking of is a row.
Oh,
And
that's great.
I know we got some overlap with the pull up, but
It
I
works.
love the rows. I do standing rows. I do seated rows. I do rows at least a couple of times a week, and I'm a big fan. What about you, Tony?
I was going to roll it into another question because I can't actually think of 5 movements that I do. I'm a runner and I just run because I like to do it, and that's kind of makes me, I guess, a little bit of a bad person as far as this conversation goes. And I was going to roll that into the question of when we look at people that are 40, what do you recommend that they start doing? What motions do you think are important to start doing as you get, into more advanced decades of your life? We do hear we were talking about abs and core strength. We hear core strength as being so important. Do you think core strength is one of those really, really important things? Sounds like you maybe don't. Or balance is another thing that we hear a lot about, is like being able to maintain balance and those sorts of things. So what are your thoughts on those movements? What are the 5 movements you think that people should, do to have a active latter half of their life?
Nice, Tony. Yeah, a lot of things there. In regards to the core, I do think that core is important. First off, for the record, I just don't do isolated abdominal exercises, and because a lot of the exercises that I'm doing require my center of gravity and my core of my abdominals and my spine to withstand loads and do isometric contraction. So I'm doing a lot of that. And also, I'm getting a lot of abdominal activation with running and also with rugby, with touch rugby, because it's more agility and it's movement. It's a stop and go, multi-directional, so and explosive. So that's why I don't really do specific core stuff. And again, like, I was just a skinny kid, so how I look under my clothes always didn't bother me, right? Now, in terms of balance too, super important. And if we were to say, hey, those over this decade and going into this decade of life, what are these major movements that would be important for longevity and for performance? I think how we have to answer that question is shifting, like, what are the specificities of what we're looking to do with it? So in our realm, it's like really what we want to do to be happy in life. And if we are active people, is to continue to be active and enjoy those things that make us feel good and make us allow us to connect with others and have that fellowship with other people in the earth as well. So like if we're not able to move and do these things, then that lowers the quality maybe of our lives. So I say with that, yes, balance training, mobility training. I see all too often I'm seeing folks come in with back pain or they have a discal pathology and they're pretty locked up and they want to return to lifting and they've got that end goal in mind and they're thinking, I want to get back. When am I going to get back to deadlifts? When am I get back to squatting and lifting? And I break it down as saying we gotta focus on mobility first. And the majority of the time when I take them through a few weeks of just mobility of their own body weight, of multiple planes of movement, their symptoms start to reduce because they've had ancillary symptoms that have come up because they're just so stuck. So I would say, one, you mentioned earlier, Chris, we sit at our desk for so long, movement. So mobility within spinal positions of trunk rotations, lower trunk rotations, extension and flexion. We're getting all the anatomical movements. Number two, balance we're talking about in terms of our single leg squats or our which I call a three-way slider. We're on one leg and we're kind of putting one foot out to the left and back behind us and out in front of us. And then the last one, functional movements, deadlifting. We gotta be strong. We got to be able to pick something up off the ground. We got to be able to pull ourselves up to a bar. We got to do a pull up. We got to be able to do a push up. We got to be able to get off the ground. And once that becomes easy, we make it harder. We progress it. We make it more dynamic. Maybe we start doing some box jumps. We start implementing some explosive exercises. So in terms of if I had to just pick like a few exercises in that, I usually don't just stick to 3 to 5. I give actually a category and say there needs to be a combination of strength training and cardiovascular training each week. And within your strength training, there can be a day where it's more mobility and balance based or directed and focused. And then those other days of strength training really are, you're doing moderate to intense amount of lifting. So if you can think of like, how hard is it? Like if I could do an exercise, one set of 100 takes 100% of me to do this, 100% of me to do 6 to 8 reps. And I could not do any more and I need to rest for several minutes. That's intense. And if we could bring that down to somewhere in between 75 to 85% of that 100%, that's intense strength training. You're getting multiple rounds, and depending on how much you want to rest in between. And that's where we dice up in between the physiology, the exercise physiology component of that formula. And that's stuff that I have to go into, but it's fun. And this is the stuff that's fun for us, right? Because we want to be able to perform and recover and do things as best as possible. So knowing what we should do, especially with runners, I know that you put on more miles on the shoes and the running shoes and probably in the gym or the weights. But what's been shown to help for longevity purposes and performance is doing like at least two moderate days a week of some sort of resistance training. And resistance doesn't even have to equal pure like heavy strength training either. So I hope that answers your question, but it's a multifaceted response in terms of like, what do we want ultimately? And we want to promote movement, enjoyment of life. And how do we get there? And what do we know? We know the older we get, the less likely we're going to do these movements that we did when we were younger as kids. I have one more example of that, if I could share. I see sometimes also vestibular cases where it's more the neurological field, but I've been trained and I treat that as well for positional vertigo. So if you or anyone you've ever known has experienced vertigo, it's more commonly seen in older populations
Mhm.
over the age of 45 and 50, in females as well. But what we do see is that, there's a change in the inner ear, what we call the semicircular canals, and people experience movement and dizziness. Like the room is like objects are not in place. They maybe experience vomiting or nausea, an imbalance. And what I tell folks is when we start to move that, they say, how can I fix this? I'm like, well, actually, we move your head and we do some sort of exercises that we can reposition the material that's actually been out of its position of that semicircular canal. And once we get that back in, people sometimes still have some symptoms where they may have some underlying hypofunction, meaning they don't function very well to movements, for their ocular movements or their head movements. So we do some training for that. And my example is this. When we were kids, you remember ever doing a somersault, like rolling down a hill, right? And you could get up, we'd be laughing. We were laughing with our friends, and we'd be a little dizzy, but we recover pretty quickly, right? We were used to doing that. I wrestled in middle school and high school and a little in college. And one of my warm-ups was to do a somersault, roll around the gym. And I could do that, and I wouldn't get so dizzy. Years later, after wrestling, I come back and try to do that. I'm immediately dizzy. I'm immediately lightheaded and kind of disoriented. And is it because there's something wrong with me? Or is it something because I used to do this, right? But what it really is I haven't done that movement. I haven't been training my vestibular system. You can actually retrain to do that movement again. So now I'm back in the wrestling room rolling around, and I don't get as dizzy anymore. So just an example there that we can reach is, as we age, it's really about, have we been training these parts, these systems? And if we can retrain, if we can get back to that time to put in, then we won't experience those same symptoms, and we can get back to a level of that function.
Now, I think that's great. And actually, it answered a lot of questions. My father actually suffers from vertigo issues and had to go through a lot of those things recently. So that was actually really interesting. And also, I really liked this thing you said about not about the age, but it's about the time. And I mean, just in my own personal experience, last December, I kind of just took it easy. I didn't do a lot of running, and I didn't do a lot of anything really. And when I went to sleep every night, and you just made me realize this. I'd go to sleep every night and I wake up and my back hurt. And I don't ever usually have back pain. I've fortunately never had back pain, but just full spinal back pain. And I've been running regularly again, and I wake up in the morning and I feel fine again. And I think it's just like, once again, when you don't do those things, then that's when that age and that starts to kind of creep in on you, and you just have to keep on repeating those things. Actually, you answered so many of my questions, I think, in that last answer. We're talking about really active people, and of course it is a podcast about fitness, but for the average person that doesn't want to go run a 50K or go ride a 100 miles on their bike or anything like that, is just gentle movement, is that enough for like a satisfying life to keep them, or not?
Yeah. So I gave the example of an untrained individual and a trained individual, and where you start with some sort of program, pre-rehabilitation or rehabilitation. And for those folks who were active, we don't necessarily have some injuries, or maybe we have some really minor low-level stuff. We got to make sure that we're stressing the body enough for a change. So, exercise is a form of stress, and that our body goes through to make adaptations. So it's a wonderful form of medicine, to be honest. Our body needs to make adaptations through stress, and we need to stress ourselves through exercise. But if we're not doing enough stress, we're not going to see a significant adaptation or a change. So, for those who, it's really about, my tagline, what I say to folks is like, what can you do differently? We're active, we're doing things, we're doing the same patterns. What could we change up to do differently? And in terms of an exercise sequence, I'm looking at a total volume. At the end of this equation is equals volume. So I'm saying what will equal this volume or affect the volume is the amount of repetitions, the amount of intensity with the repetitions of that exercise bout, and the duration of your rest period. How much rest are you putting in between each set of those repetitions? And then also how many sets. So repetitions, how many repetitions we're doing of each set, how many sets, how much was the intensity of those, and the rest period in between. And so if we're changing those 4 in this equation, the total volume is going to change at the end. So what I do is find out what is the total volume percentage of my individuals, my athletes, that they can withstand in these particular movements that we want to get them to have a better output or out product, which is our functional performance. So to answer that question, yeah, you got to always be pushing and changing, because our body will make adaptations. And then we get to the point where we're kind of plateauing. And in running, when we're plateauing and we've hit that mileage mark and we're training in these weeks, and that's okay. But we know if we don't change it and push just a little bit each time, then we're not going to necessarily go over that peak. Recovery is just as important, though, because I don't want to sound like I'm preaching about just stress. We want to stress, but there are periods of recovery, right? We need that. And I think you mentioned sleep earlier. What a foundational component to longevity, health span, and for performance is really adequate sleep. And that is something of physical medicine that I discuss with all clients that I interact with, and people of interest in health and fitness is sleep. And that's one of the 4 that I hit on. So obviously 7 to 9 is recommended for adults, but it's really about not the amount of time one thinks they're sleeping. It's the quality of that sleep and what depths of sleep cycle levels that they're hitting into for recovery purposes and for our bodies to release human growth hormone. And that's going to be that repair hormone for us.
And for me, if I don't train, I have bad insomnia if I haven't exercised that day. But you touched on a lot of things that I want to follow up on. So obviously we know exercise is stressing the body. If you look at the metrics, increases heart rate, increases blood pressure, leads to inflammation. There's all kinds of stresses the body goes through. But we do want to reduce the risk of injury there. And there are a lot of important tools to that, things like stretching. And can you talk a little bit about that, about the importance of stretching, warming up, cooling down in injury prevention, in reducing inflammation?
Thank you for asking that question, Chris, because I love warm-ups. And that is something that I do myself. I do a warm-up and cool down for not just running, but for lifting as well. And it's not a static warm-up. I'm not doing static stretching. I'm doing a dynamic stretching based warm-up. So where I'm trying to hit all planes of movement within our anatomical positions, and I'm trying to activate big multi-muscle groups. So for a lot of runners that I see, like the classic runners, like we just put our shoes on, we hit the pavement. Maybe have a glass of water. That's Tony. That's Tony. All right. And you know what? It works. It works like a lot of the time, right? Not saying it's wrong, but what I'm saying is if we can have some change as we get older, that we are maybe not recovering as well, or we're more prone to having some further injury or breakdown, dynamic warm-ups are proven to enhance performance and reduce risk of injury. It's been studied, it's been seen, it's been preached.
It's a fact.
But it's a fact. Like we're not disputing that. But what type of warm up? What do we do? How are we doing it? So I just tell folks, hey, if you're worried about like a time crunch, 5 to 10 minutes for what you got, maybe set a timer, look at your watch. And I'm going through leg swings, forward and backwards, side to side. I'm going through jumping jacks overhead, jumping jacks in front by switching my foot position. I'm going through overhead squats, and I'm doing about 5 to 10 reps of all these. That's it. 5 to 10 reps of all these. I go into some lunging, I go into some lateral squatting, and then I go into some other hamstring and glute dynamic based stretching. And I'm ready to go after that. My heart rate's increasing. That was about 5 minutes. That was maybe 5 minutes at max, maybe 3. If I'm in the gym, I'll do that, and then I'll grab a bar, and I'll grab a bar and do about 5 different movement patterns with a 45-pound barbell. Do upright row, I do a front press, I do a hang snatch, I do a front squat, I do a deadlift, and I do some bicep curls. So maybe that was 6. And I do 5 to 10 reps of those. So again, I'm just trying to hit these muscle groups, right? So the importance of warm-ups have been proven as fact. I implement them to not be some sort of stretching like we did at the middle school track that we learned from our coach at the time. And cool downs. So go to the cool down. Walking, you guys know, looking at my
Sure.
I have a Garmin, so I've got an Instinct, and I watch that, and I will walk until my heart rate recovery zone hits, and then I go through a few of a walking dynamic cool down where I'm doing like a single knee to chest hug and a 3-step in between, and I do that about 3, 4, 5 times. Then I do some Frankensteins for hamstring elongation. Then I do some single leg RDLs as I'm walking. And then I do some quad stretching. And then that's about it. Maybe I'll do some over-unders of the hurdle. And that's it. I make sure to do that so my blood is not just pulling into my legs, that we're circulating through that for the best recovery purposes rather than like getting right back in my chair, my car, or wherever I'm going to be sitting for a while. So yes, I'm so glad you brought that up, Chris, because what a easy way to start improving your tolerance to more activity. First off, we could be stressing ourselves lightly at the beginning and end of our workouts if we're not already. And also a great way to prevent injury and increase performance while you are performing.
I'm not recommending what I do. I always joke with my wife that off-road vehicles have stiff springs, so that's all I've got are stiff springs.
Yeah. Yes.
While we're on the topic of recovery, maybe we could talk a little bit about reducing inflammation. Compression, cold, ice baths, that kind of thing. What role do these play? Where should we use them? What good are they? Which ones are real? Which ones are myths? Sorry, that's a lot of things.
Yeah, I love that. So where do you guys want to put your money? That's the real question here. Where we want to put our money in our recovery. We want bang for our buck, right? Well, I'll tell you, a warm up on a cool down is free. So definitely we can implement that. Ice baths and heat exposure. Wow, those have really hit the media in the past 5 years at a high level. Do they hold merit, or are they myths? And the answer to that is there are health benefits proven, and they do have merit. And they are things that not only is, if people typically think on just a musculoskeletal recovery system, really what it's doing to your neurological system and how you're recovering for the neurological sequencing patterns to your musculature. I call it the neuromuscular functioning, how quickly a neurological response into the muscle can happen, and that recovery pattern. Oftentimes when you see folks go into getting a muscle cramp or muscle spasms, it's not 100% or the majority of the time because they're lacking potassium or sodium. It is shown that it's actually a burnout or an endurance issue with the neuromuscular connection. So the nerve is just being overworked. And so it's nerve conduction is what it is. And that goes with just how many times have we put our foot to the pavement and ran for 100 miles, right? But back to ice baths and heat exposure. Yeah, there's such great proven benefits physiologically, neurologically, and musculoskeletally for these. And one I'll hit on is the ice baths. It's shown, and the reason why I'm very interested in ice baths is really for long-term neurological functioning. And so the example I give here is trauma. When we were younger, we've all probably had some form of a traumatic event that we can recall. through our livelihood, for our life or childhood. And we can remember it. We can remember these details, and that is stored in a particular area of our brain. And the associated, we'll say, the associated part that goes along with that is epinephrine or adrenaline. So that bound allowed for us to store that memory, actually. And so what we see with iSpaz, what we're doing is getting our heart rate up. As you noticed, if you guys have done cold exposure, it's hard to breathe. Your heart rate increases. We've got a physiological response without doing any physical demands. And so that's interesting, right? So what it's doing is zapping that nervous system, and it's putting our nervous system into a fight or flight response, where we are then releasing epinephrine or adrenaline. And what it's been shown through studies is that if you do a bout of training, whether it be physical or even mental training. So years ago, I was studying for my specialty board exam, and I would be sitting there for an hour, maybe hour and a half, and then I would hit the cold shower. And because there have been proven studies, and there are high-level researchers that are still doing this daily, for just benefits of neurological health. So if we're getting benefits of neurological health by just doing this, we know that our brain, as our computer, is our primary system for the rest of our body to function, for our musculoskeletal health. So I put it a little bit deeper. I think deeper rather than just, yes, we have muscle soft tissue recovery from that. We can help improve inflammatory markers through doing cold exposure. There are benefits for heat exposure as well, with different recruitment of cells that stimulate different pathways. So yes, do they work? Yes. Why they work? Different modes, different systems they work on, but they do. And I don't have one personally, but I'm about to order an inflatable one to put on my patio and start in the winter, go full in. So that's what I'm all about. But yeah, they do work. Other forms of recovery, such as like supplementation, protein, hydration, and sleep, right? But cold exposure is a great one too. What about, pneumatic compression to lower extremities? You guys, I'm sure, have put those on your legs after long runs. Yeah. So those for blood return.
Yeah.
It's also beneficial as well. But it's like, when you need it though. Do you need it after every single exercise and bout? No, probably not. We're talking about when we're really beating ourselves up.
Just the hard ones, the long runs.
Yeah, just those like 3-milers, right?
I've never actually put those on, but I'd like to try them. I do this kind of crazy thing that I sometimes con my friends into doing with me. I call it hot and a half, and I'll see what your thoughts are on this. So what we do is we go to Nashville Hot Yoga and do a 90-minute hot yoga class, and then go directly to Percy Warner and run a half marathon afterwards. And so what are your thoughts on hot yoga? It's one of my favorite ways to do yoga. My wife's a yoga instructor. She actually doesn't care for it, but I love it. And I think that like the movement and the way you're able to just it really just loosens your body in a way that you don't get from just any yoga class. When it's 105 degrees in there under that infrared light, it's something kind of magical happens, I think.
Yeah, I've done a few bouts of hot yoga, and I've done a handful of yoga, right? I do enjoy all four multi forms of exercise. Taking yoga in itself, in an intermediate to advanced class, it's challenging. It's challenging just in normal temperature. So when you place one inside a increased temperature range, right, we're going to get all those effects that I just briefly brushed over, along with the physical effects and physiological effects. So we're combining now two things, and it's gonna actually it is gonna be harder. It's gonna be harder for folks, and you're gonna have the different physiological responses. And I think it's a good thing. People like it. And again, if it's the carrot to help them get out of bed in the morning or to go do that form of exercise, go do it. Do I personally enjoy it as much? It's not really for me. I don't have a problem sweating at all. I don't know. I just didn't really for me to do a lot of isometric and holds. It just, and I don't know. My fiance, she's really great at it, but me not so much. But for the half, you said that the half and half or the heat and half.
Hot and a half. So we do a 90-minute hot yoga class, and then yeah, we go run that half marathon you're looking to do at Warner. So it's a good time. We call it a Patriot, where you run the red, white, and the blue trail. So
Okay, so that's what Tony, that's what I'm building up to do. I'm building up to
yeah.
the Patriot right now, but I never had imagined doing an hour or 90 minutes of hot yoga prior to it. So, yeah, that's a lot. But you know what? That's the type of goals that I set for myself, is
There
just
you
stuff
go.
like this. You know, I want to keep pushing our systems. So I don't really necessarily have a great personal experience with hot yoga, but it follows the principles of thermal exposure, and there are benefits to it.
So you said you're a trail runner yourself, right? You're getting ready for you're training for the half at Percy.
Yeah, the the half that me, myself, and my buddy Dave are trenching through. We're actually changed from Friday morning to tomorrow morning to do our next bout at 6 a.m. But
Ooh,
yeah, I'm trying to train for it.
brutal hour. Running a half, running a whole, running an ultra, it hurts. It's gonna hurt. Your knees are gonna hurt. Your ankles are gonna hurt. How do we know? How do we know the difference between this hurts because I'm pushing myself and this hurts because I've done some damage?
Yeah, that's gonna typically come after the bouts of our exercise and what we've experienced when the storm calms and our systems have come back down to baseline, and we can do some inventory and see what's really the issue here. Are we recovering after 2 days? And this is running specifically, right? My knees have been more sore than usual. I do know my inventory though. I know my anatomy. I know my injuries. So I know that I've got a partially torn left lateral meniscus. And when I'm not cross training properly or doing my volume properly, and I hit Percy red and white, and maybe I didn't sleep well the day before, or I did legs the day before, I usually don't do, and my knee starts to hurt because I'm fatiguing out. My dynamic stabilizers, my hip, my quads, my hamstrings, my calves, they're not absorbing the forces as much anymore because they're burned out. They're fatigued. And that load is now going to my joint line, to my meniscus. So I know in my head, like I'll look at my watch, I'm like mile 5. And it's great on Strava. You can put like you can describe your run.
That's right.
I will put my notes down on mile 5. I had moderate amount of knee pain. And then I'll see the next run, whatever, a few days later or whatever, if I could compare notes to what my knee felt like. But in terms of that, we're all gonna hurt, right? So you guys think of just David Goggins in this, ultra runner, has gone through an immense amount of training mentally to get to where he is physically. So, you got to have some grit, and you got to want to push yourself to go through, and it's going to hurt. It's going to feel something, especially the more miles that you put on. But there's a way to do that, to know if you're trained versus untrained. So I would say the untrained runner, I would be a little more cautious on what those symptoms feel like, versus the experienced trained runner like us, who we're feeling these things. We've felt this before. We understand it. But then take that inventory 48 hours later and say, hey, what's going on now? What's going on now with it?
We know that, yeah, but people like me probably know the difference. So you did touch on stabilizers. I live in Pennsylvania, and the trails that I'm on are rocky, very, very rocky, high risk of turning an ankle. So let's talk a little bit about, is there a way to train the stabilizer muscles to reduce that risk of injury?
Single leg support, single leg balance, single leg resistance.
Split squats. Got it.
Split squats. Yes. Single leg RDL. Single legs squat to a bench. Dynamic sliders. Definitely some dynamic movements, multi-plane. Multi-plane, what I mean by that is, we're running with our arms and legs going in one plane of motion. We call that the sagittal plane. And I'm talking about, let's get back that one exercise of your 5 you chose, which is the chop, or was it the hand,
wood chop.
wood chop, right? You're hitting through 3 planes of movement there. You're going through your sagittal plane, you're going through your frontal plane, which is when you do that jumping jack, and then you're going through your transverse plane when you're doing that trunk rotation and that wood chop all the way through. So think about not just for the spine, but for the knees and for the hips. What are we doing there? How does that balance and that stability? How do we work on stability? And it's through multi-plane movements with resistance. That's exactly how you would do it.
Abductions, adductions, in addition to your typical training. That's great. That's great.
Absolutely. Absolutely.
I wanted to jump back real quick. You mentioned David Goggins, and a lot of people, that get into running, and I hear it all the time. Everybody, the first thing they do when they get into running is come talk to me about it. They're like, "Yeah, I read Can't Hurt Me," and it's good. It's an inspiring story and all those things. But I also, and I'd be interested from your perspective as a physical trainer. I think that David Goggins probably offers a lot of bad advice, because a lot of people come away from that when we're talking about injury, with this idea of like, oh, you got a stress fracture, you just run through that till the stress fracture is better and stuff like that. What are your thoughts on that? I feel like he kind of takes that line we're all trying to find between what's just the hurt of a long run and what's a real injury, and maybe makes people think maybe they should just work through the real injuries. And I don't know that that's necessarily the right move personally. I'd like to hear what your thoughts are.
Yeah. So I threw up that name, seeing what bite would come about, and I got one. I think it depends on the lens that you're receiving that information from, or if it's not information, just commentary or the story from. In his lens, it's survival of life. For what he had to go through at a young age, up until even now, and to the disabilities that he faces with ADHD and his stuttering and other things, to where he has to have this grit to the point where he knows that if he gives into that he'll be back perhaps where he was. Now, as a doctor of physical therapy, I have to be careful I'm very cognizant of how I communicate information. Be different for me communicating certain information with certain trained athletes versus the novice athlete, or for those who maybe have fear avoidance with certain things. There's really, we look at the entire medical record too of how to deliver that information. So going to that piece, we try to use information in layman's terms, which isn't what David Goggins is doing. Someone could take what you just said, run through a stress fracture. Well, David Goggins also had multiple surgeries, and because he would not have had surgeries if he did not agree that there was a pathological problem that was going to limit him from being able to do these things that he's trying to accomplish. So running through the stress fracture, he wouldn't do that. He had surgery, and he took a little bit of time off, but he did run through those things. He did run things to the point. So I think David Goggins is a specialist in his own world, and for that type of life and grit and growth. And I don't knock that. What I do say is, when there is a problem that someone's trying to interpret for where they put themselves on a spectrum, because we're all on a spectrum of this, not every person is going to respond the same way. And that's why the example I gave back is that amount of volume for each individual. And other than just the sets, the reps, the intensity, and the restoration of the volume at the end, there are other factors involved. How much discomfort can someone endure? How much sleep is someone getting? What are the stressors in someone's life outside and their relationships and their job that's affecting their pain levels as well, and their metabolic functioning? So yeah, you're right. I think for the person that is just listening to those statements and saying, you know what, I'm all in. I'm going to run until it hurts and beyond that. Yeah, I mean, it's going to hurt. Ultra running is going to hurt. We're putting on a lot of miles, and that's part of the dopamine that we seek in a way. But I think doing it responsibly is a good thing. And I think that David Goggins is a great inspiration for how at the end of the day, we can biohack all we want. We can do ice baths, we can do heat exposure, we can do supplements, we can do PRP injections, you stem cell, whatever you want to do. But at the end of the day, it's going to require work. And you're going to have to get up every day and put the time in and put the work in, because there's no special pill that's just going to make us live longer, perform better.
It's funny because, in running, but in running specifically, the novice runner has read one of two or both books. They've read Born to Run, and they've read David Goggins' book. And so you end up with a bunch of people that just think they're going to go out and, be a warrior with no shoes on, basically. And there's so much more to it. And I always, at least personally, try to tell people, it's like, yeah, these things hurt and they kind of suck to do. But if you're actually doing it and you're just not having any fun doing it at all, then like really it's not for you. Like when I talk about runs that are bad and stuff like that, and they're like, well, that made you tougher. I was like, yeah, but I mean, I do it because I love to do it. And if I didn't love to do it, I wouldn't be doing it. And I like for people, I think, to kind of get away from that mindset that maybe Goggins has to some degree of like, just suffer. And like, yeah, but there's some joy in that suffering too, I think. So but I like the way you went, and of course you were explaining it from the perspective of a physical trainer, and I'm just a runner. So
yeah, I think, and I put myself in that audience too. I was a wrestler for 8 years, started in 6th grade, and that is the hardest sport I've ever done. And it is a lot of mental battles as well. So going through discomfort in those training sessions, and also you're trying to cut weight. It's a lot. And we talk about building tolerance, or building, first off, durability. We're trying to improve our durability to running, to lifting, to doing daily tasks without pain or injury, or as we get older. But we're also building tolerance to, our kids running around and doing things that set us off, or tolerance to traffic. But the what I'm getting at is we're building further our abilities to go through discomfort and how we react to it. And we're no longer reacting, but we're choosing to respond. And there's a lot of that crosses over with physical training. And I think as we are getting older into our 40s and beyond, we're not so much relying on all the physical aspects. We have to give credit towards our mental trainings and our abilities to go through hardship and have grit, because that also is the backbone of what we're going to do physically.
That's a great point too about the grit. It's something that happens in ultras is sometimes you'll notice some of the best times people achieve in ultras are once they get into their 30s and 40s, because when you're in your 20s, you just haven't felt enough pain to even know what to expect, but by the time, you wake up with a backache every morning and, you can barely touch your toes, you know what it means to hurt a little bit more than someone who's younger. So
yeah. You also know how to leave a little more gas in the tank. I certainly cannot out sprint a 20-year-old, but there's a few of them out there that I can outdistance. So
yeah,
very different, very different. Well, this was great. JB, I really appreciate your time and all the information. This was fantastic. Thank you very much.
You got it, guys. Yeah.
Taking notes. So
well, guys, there'll be notes on some of the stuff on the blog, so check it out, and we'll catch you next time.